So welcome to session 2. We're going to be talking about metabolic adaptation. So last week, most of you that were here know that we talked about all the changes in our food. Did anybody go home and look at their labels? Anybody read labels when they got home? Did you look to see how much high fructose was in your food? Did you corn period in the food? Yep, I'm seeing yes. You always read labels. Good for you. So, and I don't know how many of you felt like, did you feel like you learned something last week?
Yes. Oh, very much so.
Okay. All right, good. So what we're going to do this week is really delve into, because of what's happened to our food, what has happened? How have things changed? And how is our health being impacted? So that's what we'll be talking about. So again, we went over last week the changes that impacted our health. This week, metabolic adaptation, solving the problem next week, and then we'll be doing desire, faith, and decision in the 4th week. I put this slide here for a reason, because not only are we metabolically seeing change, but we're also seeing change not only in the hospital, but if you purchase a car now, they now have supersized holders for your supersized drinks, right? So they've had to change things. You know, airplanes had to change things, airports changed things. Hospitals have had to change things. We now have these very large chairs. We're not buying any small chairs anymore. We're buying big chairs. If we have someone come in that is 400 pounds, we now have to move a special bed into the room, and that takes up the whole room, and it becomes a private room. And we've also had to look at Hoyer lifts will lift patients up in a chair to the bed, because when they're heavy, it's tough for us because we can hurt our backs, it can injure our backs. So their Hoyer lifts can only carry people up to 350 pounds. So if we have a 400-pound patient, we can't use the Hoyer lift. So you see that there's been some adaptation that we've had to make in order to accommodate the excess weight that a lot of people have gained. And truly, I said this last week, for a lot of people, it is not their fault. And you're going to hear tonight what happens to them metabolically and what happens to them really in the mind or in the brain, and how they begin to have these addictive qualities where they need these foods in order to function daily, and they crave them. So you'll get to see that on video tonight. I wanted to start with a human cell, and the reason I wanted to start this way is because I wanted you all to get the idea of how complex the human body is. Now, this is one cell. We're composed of trillions and trillions of cells. The whole body is made up of cells, right? So you look at this, the basic building block of all living things is a cell. But look at this one cell and what's in there. This is where the DNA is. The DNA is your genetic transcript, right? Whether you're going to have blue eyes or whether you're going to be tall or short, all of that is in there, right? What you've inherited from your family. But outside of all of that blueprint is all this information in the cell. And do you know what all this information is geared for? It's for us to take in nutrients, to use the nutrients so that so the body can function efficiently, right? So when you're eating protein and carbohydrates and fats, this cell does the work of taking in those nutrients and using them up so that we can use them, okay? Now these little guys over here, they're called mitochondria. The mitochondria, these little, you can see one's half open here and this one's fully open, is where energy is produced. I want you to remember this, okay? This is where energy is produced in the cell. The more of these little guys that you have, we have 2 here, there's a couple down below, the more of these that you have, the more energy you will produce. The less of these that you have, the less energy you're going to have, all right? So if you are not an active person and you're a couch potato, then you will have very few of these little mitochondria, because those are your energy factories. And exercise helps you build more of those mitochondria. If you don't have exercise, you don't have energy. Okay, this is really complex. So within that mitochondria that I just showed you is what we call the Krebs cycle. The Krebs cycle is where energy is produced. So all these ingredients, citrate, isocitrate, AKG, all of these ingredients around here are what kick the energy cycle in so we can produce ATP for energy. These come from nutrients. It comes from our food, eating the right food. Do you see anywhere in this Krebs cycle caffeine? Okay. I'm making that point because I want you to understand that we don't get energy from caffeine. But we all have been told that that's where we get energy. It's being sold that way, right? 5-hour energy drink. I want you to understand that is not where we get energy, and I'll talk more about that. Homeostasis. Anyone ever hear of that word before? Are you familiar with it? Okay, so a couple people are familiar with the word homeostasis. That's our internal balance, the way the body keeps things in check. So if we're eating too much of one thing, the body takes the nutrients from somewhere else to try to maintain that balance, called homeostasis. So think of the American diet and think of us eating a lot of sugar and white flour and all that junk and how it throws this balance off. The scale is totally off. And when that happens over a short period of time, the body can handle that. It can take care of it. But when this happens for 30 years, 20, 30 years, and we're continuing to eat this way, what happens is that the body gets overwhelmed and the balance gets kind of shifted. And so the body has to take nutrients from somewhere else in order to keep balance there. And it will often take it from other organs like the bones. And so we end up with a lot of bone issues. So we see people, you know, and my dad, when he was alive, he used to say to me, you know, Ann, I go to like CVS and all these places, and all these young people are in these buggies. You know, they have all the joint aching and joint pain. He said, when we were young, we didn't see that. You know, what is going on? You know, and so we'll talk about more of that in a few minutes. We've got all these systems, right, in the body. We've got the nervous system and, you know, the brain, the nerves. The nerves are all over our body. We've got the circulatory system, the digestive system, the metabolic, immune system, respiratory. We also have the musculoskeletal system. So we've got all these systems in the body. And in medicine, we put things in compartments, right? We say, if you have something going on with your respiratory system, you're going to go see a specialist that takes care of lung problems, right? If you have immune issues, you're going to go see an immunologist. If you have diabetic problems, you're going to go see an endocrinologist. So we sort of compartmentalize everything in medicine. So here's my point. The stomach, the GI tract, and everything else is kind of connected. The liver's connected to what we take in. Everything, the heart, the respiratory system, the brain, everything in the body is connected. We're not broken up in systems. I mean, we have systems, but they all work together in harmony. And if we eat horribly bad, it's going to impact the rest of our body. So metabolic syndrome is the result of the way we've been eating. We saw that last week. We saw that we're ingesting more sugar, more high fructose corn syrup than ever before. We're eating a lot, we're taking in a lot more genetically modified food. All of those things that have happened are creating what we call a metabolic disaster. And what happens is this metabolic syndrome is on the rise. You know, I work at the hospital, and patients come in. They're 40, 50, and 60 years old. I can't even tell you how many of those patients have metabolic syndrome already. It is amazing to me. The majority of them that are coming in are on blood pressure medications. They're on cholesterol medications. They already have the middle abdominal weight gain. They can't lose it. They're struggling. They don't know how to get rid of it. And these, by the way, these three are precursors to diabetes. So when you start to get high blood pressure, the next step is high cholesterol, or sometimes you get high cholesterol. I got high cholesterol first. That was my first sort of symptom. And then I had the middle abdominal weight stuff going on. And I never really got to the high blood pressure part because I wasn't going there. I knew where I was headed. And I wanted to do something very different. So I did not want to go to diabetes. I was having symptoms of mismanagement of blood sugar. And when I say mismanagement of blood sugar, I'm not just talking high blood sugars, because I never had high blood sugars. But I had low blood sugars, and I had them a lot. And as I got older, it got worse. And so understand that when I say mismanagement of blood sugars, it doesn't mean just high sugars. It also means low sugars. When you're delving down with your blood sugar, your body is giving the pancreas a message to secrete tons of insulin, and it makes that blood sugar kind of crash. And you feel awful. If any of you have ever had that, you get sweaty, you can't concentrate, you get shaky, you can't think. Some people get migraines with it. So all of that impacts our health. And it was totally around what I was putting in my body, not knowing. Again, it's not your fault if you don't know, right? So once you get diabetes, this gets scary. Because once you have diabetes, it leads to poor healing, poor immunity, increased risk for all other diseases. You end up with visual problems, kidney problems, poor circulation, amputations, and premature death. You age more rapidly than the average person does with diabetes, okay? So let's talk a little bit about carbohydrate metabolism. I just kind of want you to understand what happens. Remember that when you ingest the amount of carbohydrates that we've all been ingesting, like I showed you on the food pyramid last week, that what happens is, that I want you to think about this. Your cell is supposed to use first carbohydrates for energy. That's the very first source of energy because it's easy and quick to use for us to sort of use that energy up. And generally speaking, once that energy is used up, or that carbohydrate is used up, then the body will go to fat. But you see, we've used so many carbohydrates, and we eat so many carbohydrates, the grain carbohydrates, that we don't need to use fat. We don't burn fat. The body, the cell's memory to burn fat disappears. Does that make sense? So you take in a carbohydrate, which is pretty much glucose, which is a sugar, white flour, converts to glucose right away. It goes in here, and if in the liver, it has to go and get stored, so it gets stored as glycogen. But we have so much of it in our diet that the liver can't store any more glycogen. There's way too much. So instead of storing, it goes directly to being used as energy. But sometimes there's too much, and we don't need it for energy, so the body will take that carbohydrate or that sugar, and it will wrap it with fat and store it as fat. It will store it as triglycerides or fat in the arteries, and it will store it in our abdomen and other places, the thighs and butt or wherever. And so we end up, gaining more weight. And we don't make the connection that carbohydrates and sugar are part of the issue. Because what have we been taught? It's fat, right? We were told it was the fat, so avoid red meat. I'll tell you, when I changed my diet 11 years ago, my cardiologist had said, totally give up red meat, because my cholesterol was 226. And I had worked really hard to get it, because it was 230 something, and I had got it down to 226. And I said, I've been really working hard at getting this down, and I don't understand why it's not coming down. Have you ever said that? And so he said, well, give up the red meat. And I said, okay. I gave up the red meat totally, no change. I go back a year later, 226. Absolutely no change. About 11 years ago when I did change my diet, and I went to eating, I started reading my labels and getting rid of all the sugar and white flour and all the dietary changes I made, I went back for my cholesterol, it was 156. So we have to make the connection that white flour, sugar, those play a role in raising our cholesterol. So again, fat is also used for energy, so it goes into the mitochondria. But in order to use fat, it's a lot more work. There's a lot of processes that have to go on to use that fat. So the body is going to take the easy way out, right? Don't we all take the easy way out when we're doing things? We do the easy route. Well, the body does too. It sort of goes, oh, I have carbohydrates. I'll use those for energy. I don't need to go and do all the work of breaking down fat, right? So the cell forgets how to break down the fat. Let's talk a little bit about lactic acid, because remember, we have to produce energy to exercise, right? So in order to produce energy, you need your carbohydrate. You then exercise. The body will take from the glycogen stores to get that ATP. And as a result of that, you end up producing some lactic acid. And when you produce lactic acid, it's been said that lactic acid will go into the system and muscles, and you'll have muscle aching the next day. 24, 48 hours later, you're achy. And that it can be the accumulation of lactic acid. Okay? So there are some things you can do to help with that. And one of the things that you can do is B6. So your B6 tends to help with that. And the other thing is AKG. Let me go back a little bit. So right over here, do you remember this right here, AKG? It's a rate-limiting compound. We only produce so much of it. And so if you have AKG, which you can get from a nutrient, then you take the AKG, you take the B6, and that will help you with that aching because it takes care of that lactic acid. You'll have less of the lactic acid. So I wanted to show you this circular process that a lot of people are kind of stuck in. I often see this, and I know that every single one of you in this room have seen this happen, where people say, I want to lose some weight. So they go on, I don't know, shakes, and they go on these diets, and they starve themselves, and they will take in 500 calories for the day, when their body, you know, maybe needs 12 to 2,000 calories for the day. And so they starve themselves, and so they lose muscle mass, you know, because you're losing weight, but you're also losing muscle mass because you're not getting nutrients and protein and stuff that you need for the muscle. So you lose muscle mass. Your metabolism will slow right down. The body kind of gets the message, you're in starvation mode. I'm starving. I need to slow down so I can take care of all the functions of the body. And so then the person, after the diet, has lost all the weight, he or she's lost all the weight, and they go back to gaining all the weight back again and more. Have you seen that? Happens all the time. And so they start dieting again, and they're stuck in this vicious cycle over and over. It's just not the way to lose weight. It totally isn't. It's lifestyle changes. This is what we're talking about. It's really getting in your mind that I want to eat for good health. I want to eat for my life so I can be well. So it's a really different way of thinking. You're not thinking weight loss anymore. You're thinking of health. I want to talk about the liver. Such an important organ. Do you all realize the work that your liver has to do? I think most people don't realize. We just take it for granted that the body's going to take care of everything. And the liver today is more overwhelmed than it's ever been. I want you to look at this excessive load. I'll tell you, as a nurse I worked detox and rehab for a lot of years. And I saw a lot of people come in with cirrhosis of the liver related to this alcohol, excessive alcohol intake. However, now, today, in the past 10 years, people are coming in with cirrhosis of the liver, but it's non-alcohol related. Do you know what it's related to? The heavy amounts of sugar that we're taking in. The load is excessive, and the liver cannot handle it, and the liver ends up becoming a fatty liver. So you end up with fatty liver disease as a result. It's a filtration organ. It has to clear everything out that you are ingesting. Everything you inhale, everything you eat, the liver is going to have to take care of that. And so today, if you are exposed to smoking or secondhand smoke, or even if you are around in the traffic, who's not in traffic behind a bus or a truck, and the fumes are coming out, those things that you're inhaling, the liver has to sort of clear out. It's its job to do that. Prescription medications have to go through the liver. Your over-the-counter medications. I have a friend who is taking handfuls of Tylenol a day for his joint pain. You have to understand that's not a good thing to do, because Tylenol is very harmful to the liver over time. That's one of the side effects, is that you end up with liver damage and liver disease. So we have to be careful with drugs because there's all kinds of side effects, and taking a lot of them is never beneficial to us. Infection and illness, again, the liver has to filter out all of that. Stress. So let's talk about stress. Now, I'm talking about everything that stresses the liver out. And now we're dealing with stress, external stress. External stress, now, all of us deal with stress sometime, right? Sometimes it's like quick. Something happens, we have to deal with it, we're stressed out about it, and it's over, right? But other times our stress is long, it lasts for months, and when that happens, sometimes years, when that happens, the damage to the body is extreme. You end up with high cortisol levels, your DHEA drops, and we'll talk about DHEA next week so you can understand what that compound is. But when that happens, you do not repair well. You end up with major damage. So stress is very damaging. There is a link between stress and cancers. So you've got to take care of stresses. If you've got stresses, if they're short-lived, wonderful. But if you've got long-term stress, do something about that. See somebody, deal with it by talking to your pastor. Whatever you need to do, talk to somebody, exercise. Oh, a word about exercise, though. If you're stressed and you go stress the body out with a lot of exercise, you can make it worse. Okay, so be careful with exercise. But deal with it. Go and talk to somebody, listen to music. Whatever it is you're going to take to reduce that stress is important. Change your mindset, too. Sometimes our thoughts can create problems for us. And if we can change our thoughts, it can really change everything. Processed foods, we've already talked about this, and the load it plays on the liver, the sugar, the white flour. Environmental toxins. You heard Robin talk last week, Robin O'Brien, about genetically modified foods. This week I saw in the paper where there was a woman who had some testing done, and they found some pesticide and some metals in her blood, and she was like blown away because she's been trying to be very careful not to eat a lot of those things because she's become more aware of it, but she's still getting it somewhere. Is it in the food? Is it in the containers that the food is in? Who knows? But our liver has to process that. And then we have soil depletion, so we're missing detox minerals. We have food intolerances, we have poor nutritional habits, and we take in coffee. Maybe this is a good time to talk about coffee. Coffee is a very heavily sprayed bean. And most people don't think about that. So when you're drinking a cup of coffee 10 times a day, are you getting a lot of pesticides and sprays in your body? Absolutely. All right. Not only that, but you are stressing your system out. You've got a liver that's stressed out. You're already living a stressful life, and you're taking in all this coffee that's supposed to give you energy, and instead you're putting into your system something that's creating stress. Let me explain how coffee works. If you were to go outside and you were to cross the street and a car was coming toward you, what would happen is you would have this fight or flight mechanism that takes place, right? You're either going to get out of the way or you kind of get in the fright mode and you paralyze and you stay there, right? And so when that happens, the little adrenals that sit on your kidneys, they have to secrete epinephrine, norepinephrine, those kind of wake you up kinds of things to get that energy to take care of the situation, all right? Now, that's once. Not a bad thing, the body takes care of it. Now, the same thing happens with coffee. Would you want to have that experience with almost being hit by a car 10 times a day? Would that be stressful? Yes. So when you have caffeine 10 times a day, that's exactly what you do. You stress your adrenals out because your adrenals have to secrete that epinephrine, norepinephrine to give you that wake-up feeling. Now, 1 cup of coffee a day is not a problem. But if you're drinking 6 to 8 to 9 cups a day, it will be a problem for you over time. If it's not now, it will be. There are patients that come into the hospital. When I started working in the detox unit, we did not allow patients to have caffeinated beverages because understand that alcoholics tend to overdo in all areas of their life. So if they're going to have coffee, they're going to have 10 a day. And what coffee does is it creates anxiety. in them. And they would not only have coffee, but they would have 10 packs of sugar in the coffee that they were having 10 times a day. So we, sort of said, okay, this is not letting them sleep at night either, because all that caffeine revs you up, so you can't sleep. So we stopped allowing them to have coffee. Today, because of patient rights, we have to let them have coffee. All right, so we have patients coming in, psychiatry, who are anxious. They're coming in with anxiety. They're already drinking 10 cups a day. Probably their anxiety is related to all the coffee that they're drinking. If it's not coffee, it's soda, right? Now think of soda, caffeine and sugar. Talk about a load on the system. And they may be even adding chocolate. And not dark chocolate, but chocolate with sugar and all of that. So you've got caffeine and more sugar on top of it. Can you see the load that they're putting into their system? So they come in. We don't clean that out. No, we don't do that. We give them a medication to deal with the anxiety. So we're going to give them an anti-anxiety. Now they can't sleep at night, so we're going to give them Ambien for sleep. And if Ambien's not working, we might even add a second med. That's craziness. It's absolute craziness. I'm in the hospital. I see it happen. There's nothing I can do about that. It's the way the system is. And we have to get informed, and we have to say no, and we have to start making decisions that are more healthful for the body. So, again, if you're going to drink 1 cup, not a problem. And I want a word of caution. If anybody in here is drinking coffee with every meal, don't leave here and say, I'm giving up coffee, because you will have major withdrawal symptoms. And I do not want anybody leaving here and having major headaches and nausea and shaking and all of that. I mean, my dad clearly said that to me. He said, I don't drink that much coffee. And my dad had arrhythmias. And you have to understand that caffeine triggers arrhythmias. When I was 27, 28 years old, I had arrhythmias. They put a Holter monitor on me. And they said when I was having caffeine, it was triggering the arrhythmia in me. So I stopped drinking coffee way back then. My father, who's had an arrhythmia for 10 years, not one doctor told him about the coffee. Not one. They have that information. The journal, the journal of, what's it called, JAMA? JAMA has written article after article about caffeine and the impact to arrhythmias, to creating arrhythmias. So I had my father read the book, Caffeine Blues, which is on that table, and he read it, and he said, well, I'm going to give up this coffee. And I told him, don't give it up cold turkey, Dad. And he said, oh, I don't drink that much. Famous last words. So that was a Friday night when he said, I'm giving it up. And then on Sunday, my mom called and said, Dad's not feeling good at all. And I said, well, what's going on? And she said, he gave up coffee. I said, make him a cup of coffee. And she did, and he felt better. Yes. What about decaf? Decaf certainly has less caffeine. It's 10 milligrams per cup. So if you're talking caffeine, it's less caffeine. They do have to process it to make it decaf. So you are going to have some of those chemicals that you have to deal with. So just keep that in mind. And by the way, in Caffeine Blues, Stephen talks about a way to get yourself off coffee gradually. All right, I put this little guy here because I wanted to also talk about exercise, because so many times people exercise and think that having a cup of coffee before exercise is a good thing. In fact, a lot of runners will do caffeine, 5-hour energy drinks and stuff, before a run. And, I don't know if you've seen in the paper a few times that some of these runners have had heart attacks that died on the track. And often, they say, well, this a young person eating well and exercising all the time, why would he have a heart attack and die? Well, you're stressing out the system by putting in caffeine before a run, and you're running. And remember, exercise does give you stress. I mean, it's a good stress, but it still gives you stress. So, when you combine the two together, it's not always a good thing, especially if you've had a lot of caffeine, not only that 5-hour energy drink, but you had caffeine that morning, and maybe you cumulatively now have some in the system that's not been used because that poor liver's been challenged, and it's not clearing it out. You know, so we call that a slow metabolizer or a slow acetylator, that when people have a liver that's been challenged for 30, 40 years, and then we're drinking caffeine, you know, what happens is that the caffeine stays in the system. It doesn't clear out so quickly. And it can stay and accumulate over time, and then you'll feel the effects of that as that happens. So, for example, if you're a young person and you're drinking coffee, and you're drinking coffee all day and you go to bed and you can sleep, and you say, I don't have a problem sleeping at night. I drink coffee all day and I can do that, okay? So the person continues that habit over the next 5 years. Well, 5 years from that point, or 10 years, whatever it is, depending on that individual and how large their liver is, the larger the liver, the more surface, the more, you know, the more opportunity they have to clear things out. Smaller livers, they don't have that opportunity. My liver's very small, I'm not very big. So 5, 10 years later, this person's continuing to drink all this coffee, and all of a sudden, they're going to bed and they're not sleeping, and they can't understand why. They're not making the caffeine connection because they've done it for 10 years and it hasn't been a problem, right? So they're not making that caffeine. So they go to their docs and they say, I can't sleep. And let me tell you something about sleep. Sleep is vital. We need to sleep. If we don't sleep, we are going to be sick. When we sleep is when we heal. So it's such an important thing. So when our patients often will come in to, we call it BICU, which is Behavior Intensive Care Unit. I work there quite often. And they come in and they're psychotic because they haven't slept in 2 weeks. That's what happens when you don't get sleep. If you don't get any sleep, you become psychotic. This body needs to rest, okay? And what do you think is going to make you want to sleep? But exercise. If you have activity throughout the day, you tire the body and the system, you're going to sleep better. Does that make sense? Okay. So exercise is probably one of the most important things that you can do. If I'm going to give you a message tonight, that's the message. If you're not into an activity program, please consider starting one. I don't care if you just are walking. Walking is a good form of exercise. And it's such an important thing to your health. It's the number one thing you can do for your health. The number 2 thing is eating well, and the number 3 thing is supplementing. All right? So we're going to be talking about all those things, but I want you to get that message, okay? All right, I want to talk about this heart surgeon. This is such a good article. We physicians, with all our training, knowledge, and authority, often acquire a rather large ego that tends to make it difficult to admit that we are wrong. So here it is. I freely admit to being wrong. As a heart surgeon for 25 years, experience having performed over 5,000 open heart surgeries. 5,000. He's looked into the heart. He's seen artery and heart walls. Today is my day to right the wrong with medical scientific fact. I trained for many years with other prominent physicians labeled opinion makers. Bombarded with scientific literature, continually attending education seminars, we opinion makers insisted heart disease resulted from the simple fact of elevated blood cholesterol. The only accepted therapy was prescribing medications to lower cholesterol and a diet that severely restricted fat intake. The latter, of course, we insisted would lower cholesterol and heart disease. Deviations from these recommendations were considered heresy and could possibly result in malpractice. It's not working. These recommendations are no longer scientifically or morally defensible. The discovery a few years ago that inflammation in the artery wall is the real cause of heart disease is slowly leading to a paradigm shift in how heart disease and other chronic ailments will be treated. So, inflammation. Let's talk about inflammation. We all know what inflammation is because we've all experienced it. You fall down and you scrape a knee, and that knee gets hot, it gets red, it gets swollen. That's acute inflammation. You break a bone, that's acute inflammation. You have surgery, that's acute inflammation. The body sends its warriors to that site to heal it. It's what the body does to heal that injury. It's a normal reaction. That's a good thing. Okay, it's a good thing. So chronic exposed is different. What that is, it's injury by toxins or foods that the body was never designed to process, a condition called chronic inflammation. Chronic inflammation is as harmful as acute inflammation is beneficial. So we're talking cellular inflammation. The whole body gets affected. And most of us don't even know it's happening because it sort of happens slowly over time. So we're not aware of it. We sort of grow into it, right? So we don't feel it. We sort of say, oh, I'm getting older. I mean, when I was hitting my 50s, it was part of the aging process. That's what I thought, because I've been trained that way in nursing. I've been trained that as we get older, we do hurt because we're getting older. We do have joint pain. We do have other issues that happen. We do have, headaches, all those things, female issues. All of that, I thought, was related to aging. And it's not true. Because my mom, as I sat and talked with her at 50, didn't have any of those symptoms. But she also came from a farm. She ate off the land. She had grazing animals. She talks to me about sitting down in the fields and eating cilantro off her land. They had all these herbs everywhere. They ate so differently, and they worked all day. They got up in the morning. They were milking the cows at 4:30, 5 o'clock. Their milk was very different than what it is today. I mean, all of that was different. And she wasn't sick at 50. And she's a pretty healthy woman at her age now. People who know her in the room, she's going to be 84 in May. She'll get up in the morning at 6, and she will work all day till sometimes 10 o'clock. Now, granted, I have put her on some supplements to help her with that. But nonetheless, she's doing really, really well, okay? Compared to our 50-year-old, the average 50-year-old is on, or it's a 60-year-old. The average 60-year-old is on 6 prescription meds.
6 what, sorry?
Prescription medications, all right? So that's what we're dealing with today. When this happens, when this injury inflammation in our blood vessels from that low-fat diet that was recommended and we had all that sugar, that damaged our blood vessels. That damaged our blood vessels. What's the biggest culprit of chronic inflammation? Overload of simple, highly processed carbohydrates, sugar and white flour, and vegetable oils like soybean, corn, and sunflower, found in many processed foods. Almost all your crackers, a lot of that chips and stuff have all that fat in it. This is from his document. Visualize rubbing a stiff brush repeatedly over your soft skin until it becomes quite red and nearly bleeding. That's what he's talking about in the artery wall, okay? Keep this up several times a day for 5 years, and bleeding, swelling, infected areas that become worse with repeated injury. This is a good way to visualize the inflammatory process going on in your body. And it goes on all over in the cardiovascular system, it goes on in the joints, it can happen in the kidneys, it can happen in the liver, in the pancreas, all over, any place, depending on your genetic makeup and your genetic profile. So remember we talked about that excess weight gain? It's an interesting thing because you eat this bad food, you gain weight, you have excess fat, you have not as much muscle, right? We get older, we have less muscle, and we have more fat. But that also sets us up for more inflammation. So we end up with more inflammation. This process, it's gradual. An injury might occur, and you're going to have poor healing and chronic pain. I have lots of friends at the hospital that I work with, and they don't eat well. Nurses do not eat well. I watch them every day. They do not eat well. They skip meals. And one day I brought my caffeine blues book at work, and I had it on the counter, and one of the doctors came in, and he loves his coffee, by the way, looks at my book and he says, "Give me a break." And I didn't say anything. I thought, you can't talk to closed-minded people. It's not worth my energy or time, so I didn't, so the nurses eat bad. So one of the nurses, I'll just give you a sort of a day's worth of the way she ate when I worked with her that day. She had her donut for breakfast that the doctor brought in. Mid-morning, she had some more donut holes. Lunchtime, she said, you know, the ice cream place is down the road. I'm taking my break. I'm going to go down and get ice cream. She comes back with her ice cream and eats ice cream for lunch. It happened to be the hospital was bringing like cookies all over on every unit. So it was a big platter of cookies, so she had snacked on cookies later. It's like 5 o'clock. We still have till 7. We work 12-hour shifts. And she's saying to me, I'm so tired. And I thought, oh my God, I'd be tired too, because, you know, she's feeding her body all this sugar all day long, all right? So another one of my nurse friends, I was working with her one day, and the fire alarm goes off. And she goes to take the fire hydrant out, and as she takes the fire thing out of the fire, well, the spray, whatever you call that, the extinguisher, there we go, the fire extinguisher out, and as she does, she turns, and she hurts her knee. Now, I want to tell you her history a little bit. She had a gastric bypass to lose weight, so she's lost weight. Now, she hasn't changed the way she's eating. She only is eating less of it, right? Less of it. So she's still getting the same food. So do you think her inflammation is up? Absolutely. Okay, her inflammation is up. So now she injures her knee, should heal in 3 days, maybe 2 weeks max. She never heals. She goes for surgery on the knee. It doesn't get better after her first surgery. They go back and do a second surgery. She still doesn't heal. And she's back to work now, and it's been 2 years and she still has knee pain. But she can't work on the floors anymore because she can't walk. It hurts to walk. So do you see chronic pain? She's eating a pro-inflammatory diet. It's an inflammatory meal plan. And next week we'll be talking about how do we eat better? What kinds of foods are anti-inflammatory? How do we shift things? Okay? There's another story I want to tell about a young woman. Do I have time? Yes. A young woman who came into drug therapy. I'll never forget this. She's 19 years old. She has, I think it was fibromyalgia, her diagnosis. So she's in chronic pain. So our physicians ordered oxycodone for her chronic pain. So she's taking oxycodone for quite a few years, and she has to come in because now she's addicted. So we have to work at getting her off this addicted oxycodone. So while she's in the hospital, she tells me that she's on state aid because she can't work at 19. She's getting Social Security. And she has the debit, that EDT card. And she says, can I call my boyfriend to bring my food in with my card? And I said, sure, as long as it's wrapped. And she goes, oh, yeah, no problem. So she calls her boyfriend, and he comes in, and I have to go through everything that he brings in. And it's Little Debbie's, and it's chocolate bars, and it's candy, and it's all sugary stuff. And I said to her, this is what you eat? She said, oh, I love this stuff. I have it for breakfast, for lunch, for dinner. I eat it all day. So here we are paying for her to eat this food that's inflammatory, and we're paying for Social Security, and we're giving her a drug that she's addicted to, and now we have her in treatment that we're paying for to get her off the drug. So I say to her, do you know if you keep eating this way, you're going to be diabetic in 5-10 years. You don't want to do this. And she says, that's a lot of crap. She said other words, but I won't say them here. She said, I don't believe that. My doctor would have told me if that was the case. He's never said that to me, ever. And I said, I'm telling you, you will end up being a diabetic, eating this way. And you know who's going to pay for her diabetes? We are. She's going to be on insulin. She will be, you know, all of the other things that go on with diabetes. If she continues to eat that way, it will continue.
But her doctor doesn't tell her anymore.
No, you know, and I really don't blame the doctors, because totally doctors do not get trained in nutrition. They get 1 credit hour of nutrition. That is it.
I think the Chinese are trained in nutrition now as doctors.
Yeah, well, understand something. Different country.
Yeah.
She's saying Chinese they study or are able to study nutrition, but they also can do herbal medicine, and they can use plants in other countries. In Korea, they use a lot of plants. So they all are trained in that. But in the United States, it's a different ballgame. So here's the spiral. The injury or fat intake initiates the inflammation. So you get injured, you get inflamed, or you get excess fat, you get inflamed. The inflammation causes these negative effects. It blocks insulin. So you get an elevated blood sugar. It clogs the arteries. You end up with a release of free radicals. Let me just tell you what free radicals are. You all get free radicals every single day. We're exposed to that. When you inhale the fumes, the pesticides, when you're under stress, that's free radicals. Those are unpaired electrons that create cellular damage. Okay? And all of us are exposed to that every single day, some more than others. And the thing that sort of stops free radical damage is a diet high in antioxidants. So we will be talking about that next week. You end up with loss of muscle mass. Feelings of hunger when you don't feel hungry. You just want to eat, right? You're not really hungry, but I got to eat something. It creates more fat. You exercise, but you can't lose weight. And you try to exercise, and you're tired. And you hurt. And you kind of go, I really don't feel like exercising, right? So the fat starts the inflammatory process again. And this is a vicious cycle. So we're going to transition at this point to watching a 60-minute clip titled, Is Sugar Toxic? I think you'll enjoy this.
Now CNN's Sanjay Gupta on assignment for 60 Minutes.
The chances are good that sugar is a bigger part of your daily diet than you may realize, which is why our story tonight is so important. New research coming out of some of America's most respected institutions is starting to find that sugar, the way many people are eating it today, is a toxin and could be a driving force behind some of this country's leading killers, including heart disease. As a result of these findings, an anti-sugar campaign has sprung up, led by Dr. Robert Lustig, a California endocrinologist, who believes the consumption of added sugars has plunged America into a public health crisis.
Is sugar toxic?
I believe it is.
Do you ever worry that just sounds a little bit over the top?
Sure, all the time. But it's the truth.
Dr. Robert Lustig is a pediatric endocrinologist at the University of California, San Francisco, and a pioneer in what is becoming a war against sugar.
Deep breaths.
Motivated by his own patients, too many sick and obese children, Dr. Lustig has concluded that sugar, more than any other substance, is to blame.
What are all these various diseases that you say are linked to sugar?
Obesity, type 2 diabetes, hypertension, and heart disease itself.
Lustig says the American lifestyle is killing us.
And most of it, you say, is preventable.
75% of it is preventable.
While Dr. Lustig has published a dozen scientific articles on the evils of sugar, it was his lecture on YouTube called Sugar, the Bitter Truth that brought his message to the masses.
I'm standing here today to recruit you in the war against bad food.
By bad food, Dr. Lustig means the obvious things, such as table sugar, honey, syrup, sugary drinks, and desserts, but also just about every processed food you can imagine, where sugar is often hidden. Yogurts and sauces, bread, even peanut butter. And what about the man-made, often vilified sweetener, high fructose corn syrup?
Is it worse than just table sugar?
No, because it's the exact same. They are basically equivalent. Problem is, they're both bad. They're both equally toxic.
Since the 1970s, sugar consumption has gone down nearly 40%. But high fructose corn syrup has more than made up the difference. Dr. Lustig says they are both toxic because they both contain fructose. That's what makes them sweet and irresistible.
We love it. We go out of our way to find it. And I think one of the reasons evolutionarily is because there is no foodstuff on the planet that has fructose that is poisonous to you. It is all good. So when you taste something that's sweet, it's an evolutionary Darwinian signal that this is a safe food.
We were born this way.
We were born this way.
Central to Dr. Lustig's theory is that we used to get our fructose mostly in small amounts of fruit, which came loaded with fiber that slows absorption and consumption. After all, who can eat 10 oranges at a time. But as sugar and high fructose corn syrup became cheaper to refine and produce, we started gorging on them. Americans now consume 130 pounds per person a year. That's a third of a pound every day. Dr. Lustig believes those sweeteners are helping fuel an increase in the most deadly disease in America, heart disease. For years, he's been a controversial voice.
Here is our oral isotope.
But now studies done by Kimber Stanhope, a nutritional biologist at the University of California, Davis, are starting to back him up. She's in the middle of a groundbreaking 5-year study which has already shown strong evidence linking excess high fructose corn syrup consumption to an increase in risk factors for heart disease and stroke. That suggests calories from added sugars are different than calories from other foods.
The mantra that you hear from most nutritionists is that a calorie is a calorie is a calorie.
And I think the results of the study showed clearly that is not true.
Stanhope's conclusions weren't easy to come by. Nutrition studies are expensive and difficult. Stanhope has paid groups of research subjects to live in this hospital wing for weeks at a time, under a sort of 24-hour lockdown. They undergo scans and blood tests. Every calorie they ingest meticulously weighed and prepared.
They're never out of our sight. So we do know that they are consuming exactly what we need them to consume.
And they're not sneaking any candy bars on the side.
Yeah, exactly.
For the first few days, participants eat a diet low in added sugars, so baseline blood levels can be measured.
So remember, you guys have to finish all your Kool-Aid.
Then 25% of their calories are replaced with sweetened drinks. And Stanhope's team starts drawing blood every 30 minutes around the clock. And those blood samples, they revealed something disturbing.
And what are you starting to see?
We found that the subjects who consumed high fructose corn syrup had increased blood levels of LDL cholesterol and other risk factors for cardiovascular disease.
How quickly did these changes occur?
Within 2 weeks.
Kimber Stanhope's study suggests that when a person consumes too much sweet stuff, the liver gets overloaded with fructose and converts some of it into fat. Some of that fat ends up in the bloodstream and helps generate a dangerous kind of cholesterol called small dense LDL. These particles are known to lodge in blood vessels, form plaque, and are associated with heart attacks.
Did it surprise you when you first got these results back?
I would have to say I was surprised because when I saw our data, I started drinking and eating a whole lot less sugar. I would say our data surprised me.
So imagine, for these healthy young people, drinking a sweetened drink might be just as bad for their hearts as the fatty cheeseburgers we've all been warned about since the 1970s. That's when a government commission mandated that we lower fat consumption to try and reduce heart disease.
Major coronary risk factors.
So with the best of intentions, they say, time to reduce fat in the American diet.
Exactly. And we did. And guess what? Heart disease, metabolic syndrome, diabetes, and death are skyrocketing.
Dr. Lustig believes that's primarily because we replaced a lot of that fat with added sugars.
When you take the fat out of the food, it tastes like cardboard. And the food industry knew that. So they replaced it with sugar.
This idea that sugar increases this particularly bad LDL, the small, dense particles that are associated with heart disease. Do most doctors, do they know this?
No, they do not know this.
So
this is new.
And it turns out sugar has become a major focus in cancer research, too. Lewis Cantley is looking at the connection.
If you limit your sugar, you decrease your chances of developing cancer.
Absolutely.
Cantley, a Harvard professor and the head of the Beth Israel Deaconess Cancer Center, says when we eat or drink sugar, it causes a sudden spike in the hormone insulin, which can serve as a catalyst to fuel certain types of cancers.
What we're beginning to learn is that insulin can cause adverse effects in various tissues. And of particular concern is cancer.
Why? Nearly a third of some common cancers, including breast and colon cancers, have something called insulin receptors on their surface. Insulin binds to these receptors and signals the tumor to start consuming glucose.
So this is your body eating...
Every cell in our body needs glucose to survive. But the trouble is, these cancer cells also use it to grow.
So if you happen to have a tumor that has insulin receptors on it, then it will get stimulated to take up the glucose that's in the bloodstream. So rather than going into the fat or the muscle, the glucose now goes into the tumor, and the tumor uses it to grow.
So you've just seen that tumor turn blue, which is essentially reflective of the glucose going into it.
That's right.
So these cancers, much in the same way that muscle will say, hey, I'd like some of that glucose. The fat says, I would like some of that glucose. The cancers have learned how to do this themselves as well?
Yes, so they have evolved the ability to hijack that flow of glucose that's going by in the bloodstream into the tumor itself.
Lewis Cantley's research team is working on developing drugs that will cut off the glucose supply to cancer cells and keep them from growing. But until there's a breakthrough, Cantley's advice, don't eat sugar. And if you must, keep it to a minimum.
In fact, I live my life that way. I rarely eat sugar.
When you see a sugary drink, or if I were to offer you one, with all that you know, what's going through your mind?
I probably would turn it down and get a glass of water.
But for most of us, that's easier said than done.
Turns out sugar is much more addictive than I think we had sort of realized early on.
Eric Stice, a neuroscientist at the Oregon Research Institute, is using functional MRI scanners to learn how our brains respond to sweetness.
Sugar activates the brain in a special way that's very reminiscent of drugs like cocaine.
That's right, cocaine.
All right, let's give it a shot.
I climbed into the MRI scanner to see how my brain would respond. That's a straw that's been rigged to deliver a tiny sip of soda into my mouth.
Stay as still as you can, okay?
Okay, fine.
Just as it hit my tongue, the scanner detected increased blood rushing to certain regions of my brain. In these images, the yellow areas show that my reward region is responding to the sweet taste. Dopamine, a chemical that controls the brain's pleasure center, is being released, just as it would in response to drugs or alcohol.
So dopamine's released. That sort of makes me feel good. I'm experiencing some pleasure from having this kick.
Right, that euphoric effect.
So far be it for people to realize this, because sugar is everywhere. But you're saying this is one of the most addictive substances possibly that we have.
It certainly is very good at firing the reward regions in our brain.
Eric Stice says by scanning hundreds of volunteers, he's learned that people who frequently drink sodas or eat ice cream or other sweet foods may be building up a tolerance, much like drug users do. As strange as it sounds, that means the more you eat, the less you feel the reward. The result? You eat more than ever.
If you overeat these on a regular basis, it causes changes in the brain that basically it blunts your reward region response to the food, so then you eat more and more to achieve the same satisfaction you felt originally.
With all this new science emerging, we wanted to hear from the sugar industry. So we visited Jim Simon, who's on the board of the Sugar Association, at a sugarcane farm in Louisiana.
Would it surprise you that almost every scientist that we talked to in researching this story told us they are eliminating all added sugars. They're getting rid of it because they're concerned about the health impacts.
To say that the American consuming public is going to completely eliminate sweeteners out of their diet, I don't think gets us there.
Simon cautions that eliminating sugar wrongly vilifies one food, rather than working toward the long-term solution of reducing calories and exercising.
You know, a lot of people, Jim, are saying that sugar is different. It is bad for your heart and causing a lot of the problems that we are talking about. It is addictive, and in some cases might even fuel cancers. What would you, I mean, you've looked at this. You must have looked at some of these studies. What do you say about that?
Science is not completely clear here.
But some of these studies exist. I mean, what is a consumer, what are they to make of all that?
Well, I would say to them that they've got to approach their diet in balance.
Dr. Robert Lustig agrees. We need a balanced diet. But his idea of balance is a drastic reduction in sugar consumption. To that end, he co-authored an American Heart Association report recommending men should consume no more than 150 calories of added sugars a day, and women just 100 calories. That's less than the amount in just one can of soda.
Ultimately, this is a public health crisis. And when it's a public health crisis, you have to do big things and you have to do them across the board Tobacco and alcohol are perfect examples. We have made a conscious choice that we're not going to get rid of them, but we are going to limit their consumption. I think sugar belongs in this exact same wastebasket.
A couple of things I want to point out from this. One is, you know how you saw the fat molecules going into the arteries from consuming the sugar? What Dr. Lustig doesn't talk about was what the other cardiovascular doctor talked about, the very first article I showed you, is that there's inflammation in those arteries. And the fat molecules should be able to just flow through the artery wall. They shouldn't attach themselves, but because we have inflammation in the artery from our intake of sugar, the fat molecules will adhere to that damage, and plaque starts to accumulate. So that's why we're saying it's not the cholesterol that's the issue, but more the inflammation that's the issue. Does that make sense? I mean, I go to the hospital and I talk inflammation to any of my docs at the hospital. They think I have they're looking at me like, you are weird. Because they don't buy into any of this. And they're not going to buy into a nurse. I mean, I've worked there for a long time. I've been there for 30 years. What do I know, right? You know, one doctor I was talking to said, you know, I don't deal with any of that stuff. I want evidence-based research. And I wanted to say to him, but he didn't give me a chance. He walked off. But I wanted to say to him, you know, Doc, I've been to you, all of you for 25 years. And I followed for 25 years your evidence-based research, all of it, to the T. Exercising, doing everything you said I should do. And I got worse. It was when I bought into this and I changed things myself and I did things differently that everything changed. My life has changed. My health has changed. That's evidence to me. That's evidence. We all have a DNA blueprint. And it used to be believed that you were born, and once you were born, you have this blueprint, and it stays that way. It doesn't change, right? You've got this blueprint forever. But we now are seeing new research coming out that this epigenetic piece is about environmental exposures, that when we're exposed to all these sugars and toxins and pesticides, it changes and alters our DNA. And so moms who are pregnant and eating bad, their little embryo, their cells will be changed, and that baby that's born, if they eat a certain way and are exposed to certain things, theirs will change, and if they grow up and they have kids, theirs will be changed, and so we're going to pass this all down. And I think that's why we're seeing the number of children sicker, faster, younger, because the moms were exposed to their moms, and now they're having kids, and those kids are getting some of these symptoms. Does that make sense? Yeah. So that's that epigenetic piece that we didn't know existed, that now we are making that connection about. And I don't know if I told you in this group about the amount of toxins found in the umbilical cord of moms. Did I talk about that here? My daughter was pregnant 2 years ago, and I have another daughter that's pregnant now. And when they've been to their physicians have said, no cold cuts. Try to stay away from as much of the chemical processed foods as possible. Why? Because when they've gone into the umbilical cord of mothers, they're finding 50 to 150 different chemicals in the umbilical cord. That's from what we're ingesting. We're taking it in, and that little embryo that's growing, the brain is developing, all these little organs are developing, and they're being affected by those chemicals. I really believe that that's a part of why we see so much autism and Asperger's today. ADHD, all those type of symptoms. So, you know, I was shocked, quite really frankly, when I talked to my daughters and they said their medical doctor had said not to have these foods, and I'm like, yes, finally, somebody is doing it. So, you know, it's slowly beginning to happen. I just wanted you to know that I do have a page on Facebook. You can go and like my page. It's Proactive Health with Ann, Regenerative Nutrition, Facebook. And I do say regenerative nutrition because You know, we often hear of degenerative conditions, and we're often told by our medical community that once you have a degenerative condition, that there's nothing you can do about that. And there is something you can do about that. I'm here to tell you that. And that's why my page says regenerative nutrition, because we can change things. We just have to change and give our cells the nutrients needed to repair the cell and reduce the damage, and we can make that better. I do a call on Monday evenings. It's called a Metabolic Elimination Meal Plan Support Call. And it's a conference call. You can call in at that number, and you can get in and you can be part of that conference call. We also talk about people who have gone on an elimination diet, an anti-inflammatory diet for 3 weeks. So there's a group of us that have done that, so we support those people on the journey and help them with food choices, recipes. I hope you enjoyed tonight. Thank you, and I hope that many of you will be back next week.